Hello, and welcome, or welcome back, to this ongoing series entitled Autism Spectrum Disorder in Three Dimensions. My name is James Coplan, MD, and I will be your guide to this material. If this is your first time here, I'm delighted to have you, and if you've been following me all along, I'm even more delighted to have you. Tonight we continue our discussion of intellectual development and get into the topic of intellectual disability. And then we put atypicality and intellectual disability together into a graph to show autism spectrum disorder in two dimensions: degree of atypicality and level of IQ. And then the third dimension will come along a few posts from now. So let's get into tonight's material, because this is where things begin to get very interesting. So picking up where we left off last time, here's the diagram that I adapted from Arnold Giselle's work that shows streams of development over age. And we can see that the different streams of development include gross motor, fine motor adaptive, personal social, play, and language. And in kind of a schematic fashion, we're showing acquisition of skills over time. We left off with this figure last time, which shows in a visual way the relative contribution of motor and cognitive ability to the emergence of various milestones. So over here are milestones that are essentially 100% motoric with little or no cognitive input, and over here are milestones that are purely cognitive with virtually no motor contribution at all. And recall that the gross motor milestones, sitting, standing, walking, are largely motoric with very little in the way of cognitive contribution, where conversely over here things like fine motor and adaptive skills, speech, and play have a substantial cognitive component, and receptive language in essence is a purely cognitive function. And these are the items on the right that are more likely to be delayed in an individual with intellectual disability. And not surprisingly, these are also the items that are on the various tests for intellectual disability. To define ID, the textbook definition is significantly subaverage general intellectual function, accompanied by delayed adaptive skills and arising during the developmental period. Significantly subaverage means 2 or more standard deviations below the mean on a standardized test of intelligence. And as we just got through saying, most standardized tests of intelligence lean very heavily on looking at language and problem-solving skills. And for most tests, the mean or average is 100, and one standard deviation is set at 15 points. Therefore, 2 standard deviations would be 30 points, and scores of below 70 are in the range of intellectual disability. Adaptive skills include things we talked about last time: activity of daily living skills, such as self-feeding, self-grooming, self-dressing, play skills that we talked about last time, and socialization skills. And there are also tests or inventories that assess a child's adaptive functioning, and these are also by and large set with a mean score of 100 and a standard deviation of 15 points. The developmental period is from childhood through adolescence, although speaking as a physician, my preference is to consider birth to 5, which is the period of maximal brain growth, as the core of the developmental period. At birth, the brain weighs 500 grams. It's doubled by 1 year of age to 1,000 grams. And by age 5, it weighs 1,500 grams, which is already 90% of adult brain size. Here we see a theoretical quote-unquote normal curve. This is the bell-shaped distribution, so-called because it looks sort of like a bell in cross-section. And what this represents for any variable, this could be adult height or adult weight, or the number of times a 6 or a 7 turns up on a pair of dice as opposed to a 1 or a 12. There are more people or more events clustered in the middle, with relatively few or fewer at the upper and lower extremes, and that's called the normal distribution. And normal in that sense is a mathematical or statistical term, but in any normally distributed property, you'll find about 2/3 of the sample lie within one standard deviation of the mean, and about 95% lie within 2 standard deviations of the mean, with about 2.5% up here and another 2.5% down there. Now, IQ is not strictly normally distributed, and in fact, instead of the predicted 2.5 or 2.4% of individuals down here, there is an excess. There's about 3% down here. The upper tail is also a little bit exaggerated compared to the normal distribution. And the reasons for that are very interesting, and we may talk about another time. But for the moment, suffice it to say that most of the excess comes from finding more people with an IQ below 55 than we would expect based on a purely statistical model. This rather busy table is meant to summarize the terminology that we've been living with for the past couple of hundred years. In the 1800s, there was actually no such thing as IQ testing as we know it today. That was developed in the late 1890s, early 1910s, in the run-up to World War I. And the terms in use in those days, and they were not terms of derision, they were meant as descriptive terms, were moron, imbecile, and idiot. In the early 1900s, when people like Alfred Binet first developed what we would consider to be modern IQ testing, the term mentally retarded came into use. This was felt to be less pejorative than the terms moron, imbecile, and idiot, and when they were introduced, they were indeed technical terms without any psychosocial overlay to them. Unfortunately, people were referred to as either educable, trainable, or subtrainable, and I've got to admit that calling somebody subtrainable is a little bit pejorative right there. So that was cleaned up in the middle of the 20th century to the terms borderline retarded, mild, moderate, severe, and profoundly retarded. But then the term retarded became used as an epithet by people who would use it as a slur. So the terminology was again changed to intellectually disabled, which is the term we have now, and we refer to mild, moderate, and severe to profound intellectual disability. It's also interesting to note that the term borderline retarded was switched to borderline intelligence, and over here we have the standard deviation and IQ equivalence. So borderline intelligence is from -1 to -2 standard deviations. In other words, 100 is average, so -1 standard deviation would be down to 85. 15 points below 100 is 85. And then from there down to 70, so that's -1 to -2 standard deviations, borderline intelligence. And then mild ID is -2 to -3, and then so on as we go down the scale. One point worth emphasizing is the predictive value of infant and childhood developmental and IQ testing. And you'll run into a lot of people who will try to say that infant and childhood testing is not predictive of adult outcome, and they're partly right. They're partly right in the sense that children who are developing in the normal range, in other words, IQ 85, 90, 100 or above, you might as well not even test them as infants or toddlers or preschoolers. Test their parents, because the results on the parents are going to bear a stronger correlation with that child's future IQ than testing the child on any given day. The IQ may bounce around, or the IQ value on a test may bounce around. But that's for children who are developing in the normal range. And in fact, the further below 70 the developmental quotient or IQ is, the more predictive that score becomes of that child's long-term outcome. And this is really important to bear in mind because you'll hear therapists of various kinds try to say, oh, infant testing doesn't matter. It matters. For those of you who are mathematically or statistically inclined, there's a value called the correlation coefficient. And what that means in plain English is if we get value number 1, whatever that is, to what extent can value number 1 be used to predict value number 2? And a correlation coefficient can go from -1 to 0 to 1. Either -1 or 1 says that there's a perfect correlation. 0 means that there's no correlation at all. So we look here and we see we're starting age at the time of initial testing to 0, birth, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 years of age, and then test, retest, correlation coefficient. And what you see here is that for children developing within the normal range, whose initial developmental quotient or IQ is 70 or above, the test, retest, correlation coefficient in the first couple of years of life is 0 to 0.2. And it's not until a child gets to be 6, 7, or 8 years of age that the test, retest, correlation coefficient rises up to anything respectable. But if we look separately at children whose initial developmental quotient is in the delayed range, we can see that the test, retest, correlation coefficient is very high, even from the get-go. And Arnold Giselle actually stated this decades ago in a rather poetic phrase: contrary to the popular view, the younger the child, the more serious the prognostic significance of every degree of true retardation. Other things being equal, retardation, like a shadow, lengthens with the lapse of time. So a child who may turn out to have mild intellectual disability at 1 year of age may be functioning at a 6 to 7 month level, and that's a 5 to 6 month delay. And at 2 years of age, they may be functioning with a 7 or 8 month delay, and at 3 years of age with a 9 to 12 month delay, and at 5 years of age with a 1 to 2 year delay, and so on, that the size of the gap gets bigger and bigger over time, which is a pretty grim thing to think about. And as I said a couple of sessions ago, nobody likes to think about this. Nobody likes to talk about this. One parent said to me, I was prepared to come and hear you talk about that one, but when you started talking about mental retardation, which is the term we used at the time, it was like being hit over the head with a hammer. And I'm not here to hit you over the head with a hammer, but I'm here to give you information so that you can be a sound judge of what people are trying to tell you or promise you. So here we have the range of IQ, as we just got through pointing out. So average would be 100 plus or minus 15 points. Borderline is 85 down to 70. Or some people would say 80 down to 70. There's a little ambiguity there. Mild intellectual disability is 55 to 69, and then so forth. So we have this IQ scale, if you will. Now remember, if you think back a couple of sessions, we had this table. And this is the table that talks about atypicality. Remember, there's nothing in the definition of spectrum disorder about IQ, and there's nothing in the definition of IQ about spectrum disorder. They're separate. But they can co-occur in any individual. In fact, that's what this is all about. So we have here this table of social, language, repetitive behavior, and sensory motor, ranging from severe to moderate to mild, or over increasing age. And remember, what we did was to blenderize all of those together for simplicity, for the sake of creating a model. I know it's simplifying things, but we're here to create a model to give you a handle to think about all of this. So here we have what you can think of as the x-axis on a graph. And don't panic on me. This is very straightforward. Those of you with graph anxiety, I'll help you with that. But we can think about this as the x-axis on a graph, severe, moderate, or mild atypicality, and over here the theoretical normal. And remember, there's no sharp boundary here. Mild atypicality just shades over into normal without a sharp boundary. And we take that x-axis and we combine to that the y-axis of IQ that we just got through talking about earlier in this post, the axis of intellectual ability from ID all the way up to genius IQ. And now we can begin to think about the combination of these two things. How much atypicality does somebody have, and what is their IQ? Because we need to think about those two things acting together, because it's the joint effect of those two things acting together that's going to steer the long-term course for your child. And up here, we have children who have moderate to severe atypicality, but IQ of 70 or above. And this is what's commonly referred to as high-functioning autism. It's severe to moderate atypicality plus an IQ of 70 or greater. Down here we have low-functioning autism. These people can have exactly the same severity of atypicality, but they have an IQ below 70. Over here, the predominant problem for these children is intellectual disability with a touch of atypicality. And unfortunately, a little bit of atypicality goes a long, long way towards impairing function in a child who has ID, as opposed to what we have up here, which is mild atypicality with IQ in the normal range. And if this individual is hyperverbal and socially intrusive, this is what was called Asperger syndrome, which is something of a misnomer because even Asperger himself recognized all of these quadrants of the graph. But it was people like Lorna Wing and Uta Frith who kind of created the label Asperger syndrome to refer to individuals over here. And then we get out to this part of the graph, and there's something that's referred to as not quite autism, NQA. And here we have things called semantic pragmatic language disorder, nonverbal learning disability, broad autism phenotype, sensory integration disorder, which is the diagnosis often handed out by occupational therapists who aren't technically qualified to make any of these other diagnoses, but it overlaps. And this is a good place to start next time. We're going to unpack all of this and look at these things in detail before we add the third dimension to the graph, which is time, because all of this evolves over time. But remember, and I promised you, those of you who have graph phobia, just think of the iceberg floating in the water. And the iceberg, or the ice, is the degree of atypicality, and it can be a little bit of atypicality, a moderate amount, or a lot of atypicality, okay? And then you think about the IQ as being like the water temperature. So if we go back one, down here would be like the ice is floating in the frigid water of the Arctic or the Antarctic. And up here with high IQ is what I've drawn rather optimistically in this graphic showing the iceberg floating in the warm water of the Caribbean. And as you can envision, this ice is going to melt a lot faster than the ice floating in the Arctic or Antarctic. And this is where we're going to pick up next time. The warmer the water, the faster the ice melts. That about wraps up this post. I hope you found this information helpful. I've gone into all of this in great length in my book, Making Sense of Autism Spectrum Disorders. You can find out more about that on my website, www.drcoplan.com. And I look forward to seeing you next week when we'll continue this discussion. Thanks.